Batangas Medical Center, operating room guidelines in handling PUM, PUI, and COVID-19 patients for surgery. Theater A and B in the old operating room will be designated theaters for the duration of the pandemic. In the event of simultaneous surgeries, theaters F and G in the new operating room complex will be utilized in extreme emergency settings. A heat and moisture exchanger or HME filter must be attached to the expiratory limb of the anesthesia circuit. Both the HME filter and the soda sorb must be changed after each case. A complete airway and medication tray must be available consisting of the following: video laryngoscope, endotracheal tubes, oral and nasal airways, laryngeal mask airway, suction tip, syringes, propofol, ketamine, atracurium, succinylcholine, rocuronium, and sugamadex. Personal protective equipment. A complete list of the personal protective equipment or PPE for the entire surgical team, including the attendants and the circulating nurses, must be available. N95 mask, goggles, face shield or visor, caps and booties, double gloves, impermeable gown, coverall suit. Listed are guide on what to use on each patient category. To ensure healthcare team safety, only minimal number of people will be allowed in the receiving area. A 1 meter distance from each must be observed at all times. Patients must be provided with a face mask. Respiratory hygiene supplies like tissues, trash cans, alcohols, sanitizers must be available. And prompt recording of cases must be done for possible contact tracing and quarantine measures. Steps on donning. Donning is guided by a designated staff nurse acting as a spotter to protect the team from PPE breaches. Donning must be done in a separate area or room or in the theater where surgery will take place. Listed are donning steps in chronological order. Transfer from the ward or ICU will be done by the ward or ICU nurses in full PPE. A dedicated ambu bag must have a filter attached to it at all times, and clamping of the endotracheal tube must be done during switching of ventilators. Route to the operating room will be cleared by the security personnel. During induction of anesthesia, only the anesthesiologist and one assistant will be present in the theater. The rest of the team will wait outside the theater in full PPE unless help is needed. Patients who do not require ICU admission post-operatively will stay at the same theater for post-anesthetic care. Proper communication between OR and ICU or ward nurses must be carried out prior patient runs out. Route is cleared by the security personnel. Steps on doffing. Doffing is guided by the designated staff nurse acting as a spotter to read aloud the doffing sequence. Preferably 2 members to remove PPE at a time must be done in a separate area or room. Listed are doffing steps in chronological order. A thorough decontamination of all surfaces, screens, monitors, and anesthesia machine must be conducted after the surgery. An interval of 1 hour must be observed if possible before doing a second case in the same theater. Lastly, all staff must bathe before leaving the operating room premises.